disorganized and bizarre behavior and disorganized speech, and probable hallucinations between 1 day and 1 month of an acute stressor, don't consider this schizophrenia. This is more consistent with brief psychotic disorder. It's important to differentiate brief psychotic disorders and a normal grief reaction. Don't forget that people who are experiencing normal grief reactions, they can totally also have hallucinations and maintain some sort of connection with the person who is deceased. What separates a normal grief reaction and brief psychotic disorder, you want to look for their behavior and their speech. If they are disorganized and they are not able to relate to others, then it's most likely that you're moving towards a brief psychotic disorder diagnosis. Then what is acute distress disorder? Acute distress disorder is when you have intrusive re-experiencing of a traumatic event, and this happens when there's hyperarousal, dissociation, or avoidance of said event for less than or equal to 1 month. Now, how do these both differ from delusional disorder? Delusional disorder is when you have one or more delusions that have been present for at least 1 month, but it is not accompanied with that setting of bizarre behavior and impairment. A delusion is a collection of fixed false beliefs not attributable to a patient's culture or religion that are maintained despite being contradicted by reality or rational arguments. They can be both bizarre or non-bizarre, and again, this often occurs as a symptom of psychiatric conditions like schizophrenia or delusional disorder. When taking step 2, look at the whole picture and remember that these psychotic symptoms don't need to be brief psychotic disorder. This can also be a manic episode of bipolar disorder, but you look for key features of mania. You have prominent mood symptoms, you have increased energy, of course you have grandiosity, talkativeness, and excessive engagement in very pleasurable activities. Now, if the patient has no hallucinations, but they have very obvious functional impairment and inability to resume their normal life, don't forget to consider persistent complex bereavement disorder. Lastly, but definitely not least, don't forget schizophreniform. If a patient has psychotic symptoms more than or equal to 1 month, but less than 6 months, you definitely have to start considering schizophreniform disorder. Now, if it's more than or equal to 6 months, a more accurate diagnosis would be schizophrenia.